Workplace mental health has become a significant issue and challenge for businesses throughout the COVID-19 pandemic. Employee assistance programs and general support services like Lifeline are seeing significant increases in requests for help. Pair this with the most recent statistics indicating that the average mental health-related workers' compensation claim lasting more than 20 weeks. It's certainly something that businesses need to stand up and take notice. To help shine a light on this, On Demand HR reached out to Matthew Council from Altius Group, a national EAP provider, to get their insights as to what's really going on at ground level. And we wanted to share this conversation with our broader audience.
Sure, I appreciate that, Matt. You also reflected earlier on, the sort of the impacts on the business owners and the cost to them, the financial pressures and these sorts of things. I'm not sure if that's something that, business owners, whether they reach out directly to use the EAP program or, I guess more generally, what are you seeing as being the cost of these, lockdowns to business, and what are you hearing from businesses and or people who are business owners using the services available?
We know that presenteeism and absenteeism alone are costing the economy billions of dollars a year. And through these lockdowns, there is certainly a higher degree of presenteeism, right? There's more distractions in the home, but then when people's mental health is being impacted, when there is news feeds it's all negative in the news at the moment. There's you'd have to dig hard through the headlines to find something positive that's happening in the world at the moment. So with that constant input of negative, information, people are distracted. I know myself guilty of it. After 11, it's 11:04. After the call today, I know before 12 o'clock, at some stage, my brain will go, let's check the numbers, right? How are we doing today? Oh, it's gone up. So there's a high level of presenteeism, there's a high level of distraction, which is absolutely adding to business costs. There are more people recording absent days, sick days. I think some people manage it positively in terms of taking a mental health day and recognising when they need it. Because if people aren't taking these days, again, that's what leads to that breakdown. But it's great that someone's taking a sick day or a mental health day to look after themselves, but that's at a cost to the business as well. So EAP doesn't only need to be around crisis support and looking after people when they're broken or when they've got symptoms and when they're going through something. EAP, that's the traditional use, but it's shifting more towards health management. And if we can get more people reaching out to EAP at the moment and using it more from a health coaching perspective, getting advice, connecting with health professionals and looking at ways that they can enhance their well-being, improve their health, have an outlet, that's where employers will start to see quite a positive cost benefit as well. We know that if we can increase health, if we can increase engagement, that is going to have positive impacts on productivity and businesses.